Thank you.
So
I will be proceeding with a little bit of introduction to give our viewers perspective. Hello all, and welcome to another exciting episode of India's largest metabolic health conference 2025, where we explore various health topics that not only impact our lives but can transform them for the better. I'm your host Prasanna, a member and a certified metabolic health coach from DLife, India's first and only award-winning low-carb platform. DLife was founded in 2014 by Anup Singh, a silver medalist from IIT Roorkee and the recipient of Icons of India Award. Anup is the pioneer of low-carb movement in India with his path-breaking protocol of 100 grams per day max in 2012 that made LCHF possible for not only type 2 diabetics to effectively come out of it and for Indian vegetarians as well. In 2021, DLife launched its diploma course, which is the only course approved under NSTC partner, the Government of India, in this segment, and the only course with the global biggest 144 hours CPD hours credit. Anup Singh, along with Shashikant Nayangar, is the organizer for this metabolic health conference. Now we have with us Dr. Pankaj Gupta. To provide a brief introduction, Dr. Pankaj Gupta MD holds Doctor of Medicine in Neurology and an advocate and adherent of low carbohydrate healthy fat and ketogenic diet done in conjunction with intermittent fasting for the reversal of metabolic syndrome. He practices internal medicine, psychiatry, besides neurology in India. He has been passionately treating and caring patients now for almost 30 years. His book on migraine is the first by an Indian, has an Indian perspective and comprehensively deals with comorbidities besides newer treatment of migraine. Welcome, Dr. Pankaj.
Good morning.
Good morning.
Thank you for having me.
So, Dr. Pankaj, so the topic which we are getting in today and would like to hear from you is about low carb and various neurological conditions and how effective it will be. And can you please explain on how the low carb way of eating works in the context of treating various health disorders? And can people approach ketogenic diet as a therapy, cure, and a way of life, if you may? Please throw some light on that.
See, I think it has been reiterated ad nauseum, that there is something like essential amino acid and essential protein. And there is something like, essential fatty acid, but there are no essential carbohydrates. The body produces whatever little carbohydrate it needs. Just to give you a perspective, the 5 liters of blood that we have, it just has, 5 grams of sugar. Now, this is the sugar which every Indian may be eating in just one chapati. So, this is all that you need. And just to, take you back slightly, grains have been there only for the last 7 to 10,000 years. And the human history is that of maybe 1,00,000 years. So for, it is only for a very small period of time that we have been taking grains. For most of the human history, we have been eating meat and we were healthier. And these today's illnesses, the obesity, diabetes, cardiovascular diseases, and the neurological these diseases were not at all known. So what we conclude from this? We conclude that all the carbs which we eat from grain, and mind it, there is not one grain of truth in any grain. Any grain you take, it will have at least 40 to 70 grams, 80 grams of, carbs in it. And therefore, the ketogenic diet is not a way, it is the way. And I want all Indians, all doctors, everybody to change into this. And it is my endeavor to rope in, to baptize as many uh, patients, as many colleagues, as many friends, as many family members that I can. I should rope them in, because that's the way. And I I have a very strong feeling. I think the 1,000 years of enslavement of India is basically because of two reasons. And one is very poor protein intake, which decreased overall the size of Indian brain. And
Oh,
second is the caste system and marriage in caste, this kind of inbreeding. So these are the two reasons why no new thought has come from India. We haven't really invented anything. So many
mm,
AIs are there, and India is one of the leading nations in softwares. Where is our AI? So my
yeah.
kind of idea about carbohydrate is very, very strong. And I sincerely believe that we can cut 50% of our misery. And this 50% misery comes from illnesses, whether it is physical or mental. And this 50% misery can be cut if we choose a healthy way of life, which is low carb way of life, or whatever you may call keto.
Okay. Thanks. And so now coming to the mentality, there is usually a perception and an opinion that health disorders, in particular acute neurological disorders, can only be treated with medications. And it might be is it partially true, or is it fully true, or absolutely it is not true? And a food or a diet or a way of eating, how can it affect uh, neurological conditions? And mainly this kind of a perception is there in the Indian populace. So I would prefer to listen to you from your personal and professional opinion.
See, my idea is this, that 5 years from now, drug treatment for all illnesses will be there only for emergencies and for 3 to 6 months of time. After that, the food will take over all non-communicable illnesses. And this includes the kidney diseases, the skin diseases, the cardiovascular diseases, the neurological diseases, the psychiatric ailments, the chest disease, all non-communicable diseases. They have a metabolic basis. And therefore, 5 years from now, when the patient will come, what the doctors will do? They will immediately take a scan of a doctor, scan of the patient. And this scan will be something like, measuring the health of the mitochondria. And even today, you can do a nuclear magnetic resonance imaging of mitochondria, and you can, see the phosphate atom in it, and you can measure the ATP, and this technology will come in a big way 5 years from now. So that, when a patient comes and you take the scan and you score, and based on that, you say, okay, this patient is in emergency and he will need, mitochondrial infusion. And huge work is going on in producing mitochondria in bioreactors artificially, So for the time being, till the patient is in emergency, we will, infuse mitochondria. We will kind of, make the milieu interior and, bring the patient back to the homeostatic levels. And maybe some drug for infections and drug for, antipsychotics or antiepileptics, which have to be given for emergency. And then in 6 months time, the role of drugs will be over and the food will take over. This is my conviction. I practice, I've been practicing for 35 years, and I've been practicing low carb from since as far back as I can remember. And of late, since 6 7 years, since the internet has become very democratic and the knowledge has exploded, I have kind of practiced low carb in lots of neurological patients, psychiatric patients, and general medicine patients, and cases where the tissue damage has been there. There it might not be possible to reverse the disease. For instance, a patient of Parkinsonism where the dopamine cells have been damaged, and the patient has come 10 years 12 years late, it may not be possible. But one thing is for certain, that the benefit is definitely there. The diseases get stalled, they do not progress, and the patient feels better. And the initial hiccup of not getting onto this low carb bandwagon, no sooner the patient adopts, everything melts. So
Fantastic.
neurological illnesses also improve, and I would request you to allow me to
Yes,
present some slides. Otherwise,
sure.
talking like this, your train of thoughts go hither and thither, and I want to showcase some really new things which are not there in textbooks, and which may really be important, and which may help us understand the metabolic illnesses, particularly the neurological ones, if you may allow.
Yes, I believe you will have access to share the screen.
Okay, so I share this. I click the share, and I will. Okay, got it.
Yes, your screen is visible. Please go ahead.
Should I go ahead?
Yes, please.
Okay, so uh, today's topic is low carb in neurological illnesses. Now we begin with the basic knowledge that the human brain is very small. It is just 2% of our body weight, but it uses 20 to 25% of total energy. So the first question is, where is this energy going on in the brain? What does the brain do with all this energy? Let us now think of one neuron. So if one neuron were to be producing 100 ATPs, it would kind of spend 50 to 60% on a pump called sodium potassium ATPase pump, and 5 to 10% will be in the synaptic connections, and 20 to 30% will be in the generation of action potential. So a neuron is using all its energy to gear up to be able to respond to a signal, analyze the signal which is coming from various connections, and then fire if the need be there.
Mm.
Now there is one data which is there and doing the rounds, and that data is that 93% Americans have one element of metabolic disorder. Now this would mean that a similar percentage, or maybe 5-10% less, have insulin resistance. Now we know that insulin resistance affects the mitochondrial capacity to produce energy. Therefore we should I refer insulin resistance as energy disruptor. And if 93% Americans are having one metabolic disorder, 93% Indians are also seeing the ubiquitous carbohydrates, or even more. So 90 to 95% Indians are insulin resistant, and they have this disruption of energy production. And therefore the brain, which uses the most energy, there is some disruption in the energy production in the brain. Now we go to this slide just to understand how the brain utilizes the energy, and how it fires, and how the firing ultimately decides the symptoms that the patient will have. Now in this slide you see there are three neurons, A, B, and C. and they are in synaptic connection with the neuron Y. Now, neuron A has a positive input, neuron B and C have a negative input. Now, supposing A has this neuron belongs to a part of brain which has insulin resistance and the energy production is disrupted. So there will not be any positive input on Y. And then what will happen? B and C will have, predominant negative input on Y. So this will inhibit the neuron Y. Now, if this neuron Y is an inhibitory neuron and has an inhibitory input on Z, neuron Y will be inhibited and Z will be disinhibited. And therefore, Z will start firing, inappropriately. So this is a phenomenon which we see in, Parkinson's disease, where, the globus pallidus is disinhibited because the inhibitory inputs from the caudate and putamen nucleus is not there. And therefore, we see, the continuous kind of a pill rolling movement in Parkinson's patient. This is just to give you an idea that what this epidemic of insulin resistance does. It actually in the brain, the key word is it causes abnormal signaling, and there is actually a signaling chaos. You have to think of brain as a signaling highway, and because of this energy disruption, all the cells are firing in a berserk manner, and there is a huge chaos, and this chaos actually leads on to kind of symptoms that we see. So one neuron will be connected to thousands of other neurons, and there'll be lacks of synaptic connections. Now this slide here shows that the hippocampal neuron, which is involved in memory processing, is has very large number of connections than the cortical neuron, which may just be an associative neuron. So just imagine one neuron having 1 lakh synaptic connections and the other neuron also having 1 lakh synaptic connection. So brain uses all this energy to gather inputs from modulating neurons, from inhibitory neurons, from positive neurons which are giving a positive signal, and then it summates, aggregates, and finally it decides to fire. And it is this appropriateness which reflects in our behavior. If the neurons were to fire inappropriately, we'll have hundreds of symptoms. Now, based on whether a neuron is firing positively, whether a group of neurons are firing positively or negatively, we can have a set of symptoms which we call positive symptoms. Now, if a person were to convulse or have seizures, so this will be a set of neurons which will be firing positively in the motor cortex, and therefore these are positive symptoms. Similarly, hallucinations, as we see in psychiatric ailments, auditory hallucination, where there are no sounds, but the person is hearing sound and talking to the sound. So hallucinations are also positive symptoms. Now, a more convulsion by a patient and hallucination by a psychiatric patient having schizophrenia or bipolar disorder, they have the same pathophysiology. Similarly, negative symptoms, you can have sensory deficit as you see in stroke, or you can have depression. So the depression patient goes to the psychiatry doctor, and the patient who has sensory deficit, he will go to a neurologist. So this slide is just to show that this differentiation will ultimately be not there, and time is ripe for no such stream as neurology or psychiatry. It'll be just one stream, neurosciences. And I would like to go even to this extent that in 4 or 5 years time, we will be able to actually image all kind of emotions. So, you have pathologic jealousy, we can image it. If two people come to us and tell us, we are in love, we can, image and tell whether it is infatuation or there is some deep connection between them. And, so all there's one very important statement, and I would like to emphasize this for everybody to listen. And that statement is this, that, any kind of abnormal behavior, whether it is, disinhibition on an elderly gentleman's part who inappropriately touches a woman, or it is by a child who shows a temper tantrum, all abnormal behavior have a pathophysiologic basis, and they are deep rooted in the change in biochemistry in the brain. And all of this is ultimately connected to the metabolic disorders. So, with this knowledge, now we have learned that it is the energy disruption by insulin resistance which can cause, a whole lot of abnormal signaling, and which can cause, a gamut of positive and negative symptoms. Let me move to this slide, which is showing you here, all the downstream negative cascade of insulin resistance. Now, what is insulin resistance? Insulin resistance is very simple. If you take, 100 grams of carbs every day, and you need X amount of insulin for the carbs to go inside the cell. This is the diagram of a cell. Then after 1 year or 2 years, you will need, 2x insulin. And after 3 years, the cells will be responsible, and you will need, 4x insulin. And slowly the cells will not, respond at all. And all the 100 grams will be there in the bloodstream and raise your blood sugar. So this is insulin resistance. Now, what the insulin resistance does? First thing that the insulin resistance does is, it causes mitochondrial dysfunction. The mitochondria are not getting any energy. They are not getting any glucose, and they are not able to produce any energy. Now, when they are not able to produce any energy, the whole cell and its biophysiology gets derailed, because everything is dependent on energy. So when the mitochondria are not producing any energy, what happens? The mitochondrial enzymes, they get denatured. Mitochondria have, their own DNA, and the mitochondria have electron transfer chain, and they, conduct oxidative phosphorylation, and through this process they produce ATP, which is the currency of energy. When there is no energy, the ETC complexes in the electron transfer chains and the enzymes and the, all these things, it gets derailed. Then what happens, during the process of producing energy, free radicals are produced. Now these free radicals have to be quenched quickly, because they are, full of energy, and they can damage the membranes. And mind you, all the membranes here, the cell membrane, the membrane of the mitochondria, they have high content of polyunsaturated fatty acids, which are very, very, sensitive to oxygen radicals. And therefore, when there is no energy, the oxidative stress causes, free radicals, and these free radicals, they will damage the membranes, the cell membrane, and this damage will produce, a lot of aldehydes, and these aldehydes are, very damaging. Then, what will happen? The lack of energy will kind of, what will happen? It will produce distress in the cell, and inflammatory pathways will be triggered. We will talk more about, the sterile inflammation, which is very important. And there are inflammatory pathways in all the cells, and the inflammatory pathways will be triggered, and they will further, damage the functioning of the cell. Next, what will happen is that, the proteins which are made from, RNA messengering, and then, translation, the protein reaches to, the endoplasmic reticulum, and the function of the endoplasmic reticulum is to kind of give a 3D shape to the protein. And this 3D shape will not be given because something called endoplasmic reticulum stress will begin. And these proteins, if they have, if they don't have a 3D configuration, they cannot function. And these proteins, they accumulate in the cell, and the cell tries to get rid of it, but the proteins, they act as template, and they kind of act as, propagators of the क्या कहते हैं, the abnormal protein into the contiguous cells, and this is how all the neurodegenerative diseases, they proceed. We know that the amyloid beta and the tau proteins are there in the Alzheimer's and dementia and other neurodegenerative diseases, but the abnormal protein is the consequence of insulin resistance.
Okay.
And it is not that the abnormal proteins are there and therefore Alzheimer's dementia has happened. It is the insulin resistance, it is the inflammation, and there are other things which we will talk. Then what will happen, insulin resistance also causes advanced glycation end products, and by this we mean the glucose molecules which are during insulin resistance, the glucose is high in the blood, they go and attach themselves with lipids and with protein, and they kind of disable the protein and lipid functioning. And advanced glycation product will when the proteins have changed and the lipids have changed and they are not functioning, they are foreign to the human body, and they will further cause inflammation, they will further cause the mitochondrial dysfunction. And then there is all insulin resistance can also cause dysbiosis in the gut, and all kind of inflammatory pathways like NLRP, inflammasome, and epigenetic changes will happen. And ultimately this will hamper the cell's capacity to renew itself, to it will impair the autophagy, which is the cleaning up process, and it will cause programmed cell death, or what we call apoptosis. So this is in short what your habit of eating sugar actually does, and how through insulin resistance and through these cascades, it actually causes cell death. So I will move on to the next slide, because this slide shows you how what is chronic sterile inflammation, because it is usually the insulin resistance and the inflammation which are at the root of most of today's illnesses. Now, inflammation, as we know, is of two types. One is the acute inflammation. Acute inflammation we all have endured. If you have a cut on your finger, there will be ruber, Kala, dollar, tumor, as we have been taught. It will be red, and there'll be heat, and it will pain, and there will be swelling, and then after 4 or 5 days, the cut will be healed. Therefore, acute inflammation is very important. Without acute inflammation, humans would not survive and we would die. No, no wound will heal. But what is chronic inflammation? Chronic inflammation is usually sterile. There are no bugs, there is no bacteria, there is no virus. The symptoms of chronic inflammation are very kind of dodgy, and it's very difficult for a patient to understand that these symptoms are coming from where. For instance, a patient can just come and complain of foggy brain, of feeling fatigue, of having low backache or digestive issues, some kind of general weakness. So they are not specific, and it is difficult to pinpoint whether a patient is having some kind of a specific disease. And the symptoms of chronic inflammation are very, very vague. Now we come to, so what causes chronic inflammation? Now this is very important, because the awareness amongst doctors and among patients, all of them, the triggers for chronic inflammation, awareness is not there. Now, as we have just discussed that insulin resistance itself triggers chronic inflammation. All inflammatory pathways in all cells, and mind it, inflammatory pathways are there in all cells. Any stress is a change, whether this change is outside the body or this change is inside the body, and stress is defined as the reaction to that. And therefore, chronic inflammation is a reaction to insulin resistance, which the cell perceives as stress and triggers the inflammatory pathways. Now we come to, the um, inflammation, which is, chronic inflammation, which is triggered by outside. So we have sugars, the table sugar that we eat, it contains fructose and glucose. And then we have, the fruits which contain fructose. We have gluten, in wheat, and whole of North India is eating, wheat. The gluten is a highly inflammatory substance. And there are two kinds of gluten, inflammation. One is, the full-blown celiac disease that we see, and the another is, the gluten sensitivity, which in my practice, I feel, 40 to 60% patients will have it. Then we have, these processed foods, all kind of packaged foods, and they will have, the seed oils, and they will have, the processed sugars in it. And there are emulsifiers and stabilizers and coloring agent and bulking agents. And, we have the large omega-6 fatty acids in the seed. Then we have, these heavy metals. They are there in all kind of food, in fishes, mercury, arsenic in Ayurvedic drugs, aluminium from industry,
Yeah.
Then, our Indian cities are, notorious for having the worst kind of pollution. And we may not, feel the effect of pollution in a week or days time, but pollution is known to, cause chronic severe inflammation. Then, we have the household kind of inflammatory stimulus, and they begin from kitchen. In the kitchen we use non-sticks which have, CFOs. Then we are using oils and the vapor of the oil. Then we use deodorants, we use room fresheners, we use, dyes on our head, we use, we vacuum, and while vacuuming we don't, put on a mask. Then there are insecticides, there are pesticides, there are herbicides. We burn, incense sticks, and we burn diyas in a home, and then, the microplastics are there. And one most important, chronic inflammatory stimulus comes from dry cleaning. Trichloroethylene is used, and this trichloroethylene, it gets dried up, and it vaporizes, and it can go into your, nose, and through your lung it can, cause inflammatory trigger to inflammatory cells, which may affect your brain. So, the chronic sterile inflammation can be from inside the body, and it is, when it is inside the body, it is usually because of, insulin resistance. When it is from outside the body, you have to consider on a patient to patient basis, and you have to look at the four, orifices. What's happening through the mouth into the gut, what's happening in the skin, what's going through the nose, what the person is breathing, and is going into the lungs. And as we cover the neurological illnesses, we will tell how, the insulin resistance and chronic inflammation is the root cause of these illnesses. And if we take care of them, there might not be any need to treat the patient for, very long time with drugs.
Yes, so this particular slide is very illuminating, and some of the things which people usually uh, it actually gets overlooked, such as the environmental toxins, which actually the main culprit, as per your uh, data is insulin resistance. And some of the things which we usually miss, which actually create and antagonize the underlying condition, are the environmental toxins, which people usually do not look at. It's quite illuminating, doctor. And now that we have about 4 minutes left in our session, may I ask? I know that we have a lot of pathways that we have to cover.
I will just hurry on and mind it. 10 minutes were taken by the previous speaker. So I will, just request you to, give me 10 minutes more. I will be very quick. The main part has been done. So forget about the pathways, and let's come to, the, low carb in epilepsy. Now, in epilepsy, we see patients every day, and epilepsy patients, they will come, you do a CT scan and a EEG, and these are normal, so we don't know where this epilepsy is coming from. And when you get the fasting insulin done, when you get the magnesium levels done, and vitamin B12 and vitamin D done, all of these are, not in line. And then you explain the patient that, it is the high insulin which has, caused energy disruption in your brain, and the lack of nutrients, the magnesium and vitamin B12 and vitamin D, they are contributing. And when you put the patient on low carb, the ketones are anti-inflammatory, and they maintain a balance between excitatory glutamates and the GABA, and the patient immediately becomes better. Then we come about the role of low carb in migraine. Most migraine patients do very well on low carb, I'm telling you. And the reason is, because migraine is a immunometabolic disease, and they have, high insulin, they have, glucose intolerance. And once you tell them not to eat, glucose, once you tell them it is the insulin which is causing the migraine, once you tell them that it is the, the fever, many patients of migraine will have fever, and you tell them that the fever is because of, the inflammation that the insulin resistance is doing, and explain the basis of their symptomatology, they do very well. And in my experience, most patients do so well that they are off drugs in 3 to 6 months time. Now, one very important, and this is a very important slide. In India, neurocysticercosis is very common. People, they defecate outside, and the stools, they have the cyst of neurocysticercosis, and through vegetable and water, they find their way into the brain, and they are a very important cause of seizures in India. But these seizures also produce headaches, and the reason is this calcific speck here would have lied quiescent, but for the inflammation. And you can see the inflammation in CT scan as hypodensity here. And this inflammation is triggered by insulin resistance, and by bidi smoking, and by all kind of pollution, and through gut. And this the central nervous system and the peripheral nervous system, we have immune cells in the form of microglia. And when they are chronically inflamed, the microglia, they are of M2 types, and they change to M1 type. And when they change to M1 type is a monster microglia, and it will cause inflammation over here, and this becomes a constant source of seizures and headache, unless and until you recognize this and take care of the inflammation also. Let us not now come to Bell's palsy. Bell's palsy is a condition where the seventh nerve is damaged. Okay. And the seventh nerve is damaged because the risk factors are pregnancy and diabetes, and both these conditions have high insulin levels. There is one more mechanism which I want to tell, and which is not usually highlighted in textbooks also, and that is this seventh nerve, this comes from a small foramina, and this foramina is called stylomastoid foramina, and this is a very small foramina. And because of insulin resistance, there is increased water content in the body, and the nerve gets pinched at stylomastoid foramina. So once the Bell's palsy patient is there, and you tell what is happening, they immediately lower their carb intake and will not have, Bell's palsy in future, and they also improve very fast. Similar thing in, carpal tunnel syndrome, where, you usually have a, recently I had a lady, she delivered a baby boy, and she was being pampered, and all sorts of, goodies were given to her, high carbs, and that, she had a lot of, edema, a lot of water content. And in carpal tunnel syndrome, this nerve, carpal median nerve, it gets, compressed in the tunnel.
So,
And give low carb, once you give low
Doctor,
carb, the
okay.
once you give low carb, the the symptoms abate and the patient becomes better. We now come to the main part of the my presentation. I will just take 5-7 minutes more. Now, in India, the dementia, we don't see Alzheimer's dementia very commonly, because the patients start presenting after 70, and the average age in India is 66, 67. What we see is vascular dementia and a kind of mixed dementia. Now, when a vascular dementia patient comes, we tell the patient, you have had a brain attack. And this brain attack is because of, 6 causes: insulin resistance, high blood pressure, high blood sugar, dyslipidemia, tobacco, and alcohol. Once you tell them, you give them, the solution, low carb, and the drugs are needed for very short length of time, and they become better. Now, we come to Parkinson's disease, and, Parkinson's disease, along with Alzheimer's dementia, along with, motor neuron disease, and so many other neurodegenerative diseases, all of them, let me tell, they are all immunometabolic diseases. What happens in them is, there is insulin resistance, and the insulin resistance sequelae, the oxidative stress and lipid peroxidation, it ensues. And then the patient has, endoplasmic reticulum stress, and there is protein misfolding, and the protein gets accumulated, and we get to know Parkinson's disease as, a synucleinopathy. It is the proteins have got nothing to do with that. If you can identify the inflammatory cause, if you can identify the, the insulin resistance, and you treat both, there will be biogenesis of mitochondria, there will be neurogenesis, and patients definitely improve. And this is my last slide, just to give you a perspective, and this will be for the next speaker also, So this is the data, in multiple sclerosis, 10 to 15% patients have, frank diabetes. 60 to 70% will have one abnormal, they will have abnormal glucose tolerance tests. 40 to 60% will have insulin resistance, and 80 to 90% will have metabolic dysfunction. Now, in Alzheimer's dementia, these are even more striking. 20 to 25% will have frank diabetes, 70 to 85% will have abnormal GTT, 80 to 90% will have, insulin resistance, and 90 to 97% will have, metabolic dysfunction. In migraine also, 10 to 15% will have diabetes, 75 to 85% will have abnormal GTT, and 50 to 70% will have insulin resistance, and 90 to 97% will have one metabolic dysfunction.
This particular aspect about Frank's diabetes, it's completely new, and thanks for bringing this up. And right now,
there's one more thing. This data is there if you search the literature. But while I was preparing this slide, I had this latest Harrison, and I went through the chapter of Parkinsonism, and there was not one word mentioned about, diabetes, about abnormal GTT or metabolic dysfunction, So I don't know, there is a concerted effort amongst the, medical educators to kind of complicate things and put it in a way which is, kind of intimidates and the student. And when he comes out, he thinks that, he's very knowledgeable, but none of that knowledge is, actually doing any good to the patient. And so I will end this thing. Sorry, I have to take 2 more minutes.
Dr. Pankaj, it's a really illuminating session, and I believe that we have lots to discuss more, but we will do it in some time later. And I would like to invite Shashi and Anup to say a few words.
Dr. Pankaj, thank you very much. And first of all, apologies for that delay, 6 minutes delay which we had. But nevertheless, you have a very interesting data, and we know the kind of topics you post in X, that you have a wealth of experience in this, and maybe we will have a much more detailed discussion in D Life podcast, and discuss much more in detail. I think your details are very, very valuable for India, and the message should get through. Thank you very much, doctor. Thank
Thank
you.
you very
Thank
much.
you. Thank you so
Thank you.
much. Namaskar.